Hello everybody, I am Dr. Senthil Kamalasekaran, Senior Consultant Orthopaedic Surgeon at Chennai Ortho Clinic, and today I am going to talk to you about a very common problem, multiple joint pains. Multiple joint pains affect the community and we can see many patients coming to our clinic with these symptoms. Joint pains can be very disabling and the main problem for this is a condition called rheumatoid arthritis. There are other conditions which can also affect the joints like psoriatic arthropathy, ankylosing spondylitis, diseases which can be related to inflammatory bowel disease, but the most common thing which we see in our population is rheumatoid arthritis. We will see the presentation of the problem, we will see how to diagnose the problem, and we will also see the treatment modalities for this very common disorder. Rheumatoid arthritis affects mainly women and has a genetic predisposition. There are also other factors which are under investigation to find out about this immunological problem. It starts off with joint problems mainly affecting your small joints like the hands. Apart from this, it can affect the knees, the ankles, and the neck. The lower lumbar spine and the dorsal spine is less affected in this condition. Apart from joint problems, people do present with other problems also, like they might have skin nodules, they can have lung problems, they can have liver problems. However, to diagnose this condition, you need to see a specialist, and once we have evaluated you, we put you through a battery of tests. We also do a chest x-ray and we do x-rays of your neck to see whether you are having any problems. If you are suffering from knee joint arthritis related to rheumatoid, the presentation can be completely different from a person with osteoarthritis. Knee joint in rheumatoid arthritis goes into Knockknees, whereas in osteoarthritis, people present with Bowlegs. Okay, this is a very simple way of finding out the kind of arthritis you're suffering from. Once taken x-rays, we look into the calcium content in the bones, we see for osteoporosis, and based on that, we reach a diagnosis. Once we have reached a diagnosis, we have to start you on treatment. Rheumatoid arthritis can be treated nowadays very well, and the disease can be kept under control. So once you see your doctor, it be an orthopedic surgeon or it can be a rheumatologist, or if you are seeing an endocrinologist, most probably they would put you on ordinary anti-inflammatory medications to start off with, which we call non-steroidal anti-inflammatory drugs. Once you take these and your symptoms subside, then it should not be a problem. However, if you continue to have symptoms of small joint pain and early morning stiffness in your hands or in your feet or in your knees or your ankles, then we normally put you on a very short course of steroids. Once I tell steroids, many people get scared. The thing is, the steroids taken in the right dosage at the right time does wonders for preventing damage to your joints. So taking it at the right time, at the right dosage will benefit you to a great extent rather than you not taking it and allowing the disease to progress and landing with severe arthritis. We do have newer medications for treating this condition, which we call disease-modifying drugs. These disease-modifying drugs have been in the market for a long period of time, helping patients keeping the disease under control. Of late, we are also putting patients on immunomodulating therapy, which we call biologicals. These biologicals have changed the management of rheumatoid arthritis in a drastic way. These magic drugs, which normally given over a period of 15 days, can actually take away the symptoms. However, we have to make sure that you don't have any problems in your blood picture. We also test whether you have had any kind of tuberculosis. So we do a MAN2 test or we do a TB interferon test. So only when you are not having all these things can we put you on these biological therapies. These biological therapies, once given, can give you significant relief. So you don't need to take a whole load of medications. A single injection can actually do wonders to your treatment. So that is something which you have to keep in mind when you have this kind of problem. And last but not the least, if you have this problem, you need to keep your joints mobile. So, apart from seeing a doctor, you might need to go see a physiotherapist, and you need to do exercise to keep your joints supple. The more you keep your joints supple, the more will your symptoms get relieved along with medication. And last but not the least, if you have rheumatoid, don't forget to take your flu jab. So, people who have rheumatoid arthritis are more prone for getting infection of the lungs. So, please do take the flu jab and prevent yourself from getting any kind of severe lung infections. I hope this short video has given you some insight into what this problem is. If you like this video, please do like, share and subscribe. Thanks.